There are many different medicines used to treat diabetes. But why are there so many different types? And how does each one actually work? Let's understand diabetes medicines simply. First, let's understand what happens in type 2 diabetes. After we eat, carbohydrates are broken down into glucose. Glucose enters the bloodstream and needs to move into our cells to be used for energy. Insulin helps this process. But in type 2 diabetes, the body may become resistant to insulin. This means insulin doesn't work as effectively as it should. The pancreas may also gradually produce less insulin. The result is higher blood glucose. This is where diabetes medicines come in. Let's start with one of the most commonly used medicines, metformin. Metformin mainly works by reducing the amount of glucose produced by the liver. It also improves the body's sensitivity to insulin. So, in simple terms, metformin helps the body deal with glucose more effectively and reduces excess glucose production. Common side effects include nausea, diarrhea, and other stomach-related symptoms. Next are sulfonylureas, such as gliclazide and glimepiride. These medicines work mainly on the pancreas. They stimulate pancreatic beta cells to release more insulin. More insulin can help lower blood glucose. But there is an important point. Because these medicines increase insulin release, they can cause hypoglycemia, or low blood glucose. Now let's look at DPP-4 inhibitors. Examples include sitagliptin, vildagliptin, and linagliptin. These medicines work by increasing the activity of incretin hormones. Incretins help increase insulin secretion when blood glucose is elevated and reduce glucagon secretion. The result is better blood glucose control. Next are SGLT2 inhibitors. Examples include empagliflozin and dapagliflozin. These medicines work mainly in the kidneys. Normally, the kidneys filter glucose and then reabsorb much of it back into the blood. SGLT2 inhibitors reduce this glucose reabsorption, so more glucose is passed out of the body in urine. This lowers blood glucose. It also explains why increased urination can occur with these medicines. SGLT2 inhibitors can also have benefits in certain people with heart failure or chronic kidney disease, depending on the medicine and the patient's condition. Now let's look at pioglitazone. Pioglitazone belongs to a group called thiazolidinediones, or TZDs. Its main effect is to improve insulin sensitivity. In other words, it helps the body's tissues respond better to insulin. However, pioglitazone can cause weight gain and fluid retention, so it is not appropriate for everyone. Another important group is GLP-1 receptor agonists. Semaglutide is one example. These medicines mimic the action of a natural hormone called GLP-1. They can increase insulin secretion when glucose is elevated, reduce glucagon secretion, slow gastric emptying, and reduce appetite. Because of these effects, some GLP-1 receptor agonists can help with both blood glucose control and weight loss. Common side effects include nausea, vomiting, and diarrhea, particularly when treatment is started or the dose is increased. There are also medicines called alpha-glucosidase inhibitors. Acarbose is an example. These medicines slow the digestion and absorption of carbohydrates in the intestine. This can reduce the rise in blood glucose after meals. However, they can commonly cause gastrointestinal symptoms such as gas and diarrhea. And finally, we have insulin. Insulin is different because it directly replaces or supplements the hormone insulin. It helps glucose move from the blood into tissues and lowers blood glucose. Insulin is essential for people with type 1 diabetes. It is also used by some people with type 2 diabetes when other treatments are not enough, or when insulin is otherwise clinically indicated. Different types of insulin have different onset and duration of action. So let's quickly bring everything together. Metformin mainly reduces glucose production by the liver. Sulfonylureas increase insulin release from the pancreas. DPP-4 inhibitors enhance the effects of incretin hormones. SGLT2 inhibitors help the kidneys remove glucose through urine. Pioglitazone improves insulin sensitivity. GLP-1 receptor agonists act on the GLP-1 pathway and can improve glucose control while reducing appetite. Acarbose slows carbohydrate absorption after meals. And insulin directly replaces or supplements insulin to lower blood glucose. The important thing to remember is that diabetes medicines do not all work the same way. They target different parts of the body's glucose control system. The right medicine, or combination of medicines, depends on the type of diabetes, blood glucose levels, other health conditions, treatment goals, and the individual patient. So don't think of diabetes medicines as a long list of names. Think about where they work and what they do. That's what makes them much easier to understand. Medicines for diabetes should always be used according to the advice of a qualified healthcare professional.